In the middle of the night, I just started bleeding uncontrollably. I did not know what was the reason. I forgot I took this porcupine bazoa.
At here we have to mention, please, don't do massage. Please don't do massage.
Good afternoon, everyone. Welcome back to Talking Life with MeiSze. I haven't seen you guys in almost a year, and thank you to those who answered my question on wanting me to come back on the show. So today's show is mainly focused on a lot of main topics or questions that you guys had previously. We're going to talk about decoding traditional Chinese medicine, short for TCM, and how safe is it for cancer management. And as you can see, I have two esteemed doctors here today with me on the show. We have Dr. Teo Yin Keong, consultant clinical oncologist with 15 years of experience. And we also have Dr. Tan Hai Chyan, who is a TCM oncologist, and they both work hand in hand. So there's so much to know. I think many of you have tons of questions all the time. And today we're going to dive into those questions. Those questions that we're talking about is how safe is TCM for cancer management? And is it recognized by the Ministry of Health? And of course, how can it complement modern healthcare technologies for better cancer management? So I think, like I mentioned, we have two esteemed doctors here. We're going to jump straight into the questions that I've already collated from all of your questions in my past shows. So we'll start off with Dr. Teo. What's the difference in cancer treatment approach between Chinese versus Western medicine?
Okay, that is only my personal point of view, okay? Don't feel offended. Okay. So for me, Western medicine, they are focused more on evidence-based. Evidence-based means we need to know why this thing works, how it works, and we know the exact dosage, we know the side effects, we know the mechanism, so that we can interfere, so that we can do after that, we can do interference, we can do the dose reduction, we can do the adjustment accordingly. And after that, we can collect all the data and see how we improve the outcome. This is the gist of the evidence-based medicine. And nowadays, TCM also started to have this approach. But conventionally, they are more based on the experience-based. That means they get the experience from the previous seniors and how this thing works. They know this thing works. They may not know how this thing works.
Okay.
Something like this. Yeah.
Okay, thanks, Dr. Teo. I think the other question that many of us, or rather I want to know, is identifying real traditional Chinese medicine versus folk remedies. So earlier, all three of us were discussing like how previously when I had cancer, aunties, uncles, relatives, friends came to me and say, buy this anti-cancer clothing, or socks, or even a blender specifically for cancer management. So there are tons of things like that. And of course, many of you know porcupine bazoa. So I think this question is more for Dr. Tan, and then Dr. Teo can add on after this. Yeah. Dr. Tan, how can we differentiate between real TCM versus what I've just mentioned, all these folk remedies?
Yeah, of course, in Malaysia, we start from 2016. Our KKM have already recognized traditional Chinese medicine is below the TCM Act. So below the TCM Act, we are included like the traditional Malay medicine, Indian medicine, Chinese medicine, osteopathic, homeopathic, Islamic medicine, and chiropractic. So that is included 7 medicine. So that if TCM practitioner who is registered under the KKM, of course it can be so-called as the registered practitioner. Yeah, but the problem is it registered practitioner is the TCM oncologist? That is different topic, right? Yeah, so that for the TCM VP, like for the Western doctor, got VP and also the specialist. Yeah, so if got the cancer, of course we have to go for the specialist. It's better. Yeah, and yeah.
You would definitely say from what you are mentioning is that to differentiate the folk remedies versus traditional Chinese medicine is to get the proper traditional Chinese medicine, which is like you, TCM oncologist, correct?
Yeah, at least you have to register under the KKM.
Okay.
Now that is the first step, the priority.
Right.
And like just now said, they have a lot of product, for the herbal, right? So like just now we said, in the Mandarin we call the jian猪枣, right? There's a lot of product. At first, we have to say in China, they have a lot of product, Chinese medicine product that they say that they can use in the cancer management. But all of the product in China, they are under the research and got the evidence base. Of course, based on their own research. But in Malaysia, is it so-called like the jian猪枣, like the herbal, got those research? Then I think that is very doubtful. Yeah. So like just now, Dr. Teo said, TCM also we are going to the evidence-based approach. Yeah, that is what we are looking for, and we are also try to be more scientific. Then can let the public know us and understand us. Yeah.
So I think to reiterate, the most important part is to get a registered TCM under the KKM, and also evidence-based practices, just like Western medicine. So Dr. Teo, do you want to add on to this? Or maybe you can share with me that, you previously mentioned that some patients come in and ask about apricot seed for cancer management, or like I mentioned, porcupine bezoar, because they feel really weak and they feel that these are the things that their relatives or people around them have told them about. So the question, I think, for many of us, cancer patients and survivors, how do we know that these remedies are actually reliable, and can it really make us stronger, and does it really complement cancer management?
Okay, frankly speaking, all the product that he mentioned just and you mentioned just now, right? I never see anyone succeeded.
Okay.
Most of the time they just took it for the sake of no harm to try.
Okay,
like Malay community, they will go for belalai, gajah, apricot, keladi, tikus. Chinese community will go to some direct sales product or the porcupine, bezoar, this kind of thing. So it's like some people think it no harm to try, never know, right? But for me, we still need to go for evidence base. So if you want a certified oncologist to actually acknowledge the usage of this kind of thing, it make me feel very this is not the professional way of giving the answer. Okay. Last time, I used to be very strict on my patient and say that you must not take. But I realized that they don't care. Right? Some of their friends and relatives, they will still persuade them to try this and that. So what I always tell them is, if you want to go for traditional Chinese medicine, or nowadays I try to omit the word traditional because they are no longer that traditional anymore. Yeah. They just Chinese medicine. You must go to a proper one, and not a general Chinese medicine. You should go to Chinese medicine who subspecialize in oncology, like Dr. Tan. Okay, because they can give you a proper explanation. And do you realize that their first few years of training during their medical career, we actually learn the same thing from Western medicine also. The first few years of their university life, we have the same textbook, almost the same textbook. We learn almost the same thing. It's just that when we come to treatment part, we start to deviate.
Nice.
Yeah, that means Dr. Tan himself, he will look at the scan. He will look at the blood result. That's why we can cooperate, because his patient, when they come to me, he will know that what he gave, and he will let me know what he gave, and I will see the result. If the blood is okay, patient is okay, then okay, I say no harm to continue if he's helping the patient. But if it's like the whatever medication is causing problem to the liver already, then I will tell him that this patient liver have a problem. You need to stop something, or you need to adjust something, or maybe is it due to my drug, or is it due to the medicine that he gave. Okay, so at here I just want to make the thing clear that I am not promoting the two things together. I just said, if you want to do, there is a phase for you to do. Like for me, any patient on chemotherapy, active chemotherapy phase, right? Usually, I will tell them take wisely. Okay, must under proper supervision. But let's say if you're after surgery, after radiotherapy or chemotherapy completed already, you're on long-term surveillance, you're on recovery phase, free to go. You can anytime go for this kind of treatment. It's okay, but make sure it's evidence-based, because I always give 3 criteria for my patient. Okay, whenever anyone suggests anything to you, 3 criteria. I made the criteria. One criteria. First criteria is this thing must be acknowledged by any Chinese physician, Chinese medicine, or government hospital or private hospital. That means they acknowledge this thing before you start. Second thing, anyone is going to pay the legal responsibility for the usage of this thing.
Yes.
Okay. Third thing, do your insurance accept you to do this or not?
Yeah.
That's true.
Yeah.
So because one of the criteria for insurance to bar you, right, is actually self-inflicted injury. A lot of people, they misunderstood the word of self-inflicted injury. Okay, anything that you do that cause problem to your health, they can choose not to pay for anything.
Yeah.
Okay, there is this clause. A lot of people underestimated this clause. Okay, so make sure you come across these 3 criteria. If you still think that this product was to consider, you proceed.
I think that those 3 criteria are actually very important. Like for me, honestly, just sharing with the both of you and actually to the audience today, when I did a surgery quite recently, I was recommended to take porcupine bezoar because I was feeling weak. But then what happened was, it was really scary, to be honest. In the middle of the night, I just started bleeding uncontrollably. And I did not know what was the reason. I forgot I took this porcupine bezoar. I was rushed to the ER and had to inject me to actually slow down the bleeding. But the bleeding didn't slow down much. So I was under observation. And when I contacted my doctor, he actually said that, how can you be so silly? What if I told you do not take these things? And he's like, even before that, he was like, you must go to the ER now. So, I mean, to all of you out there, I think the most important part is, like both doctors mentioned, to differentiate what folk remedies are and to actually see a real certified TCM oncologist if we are going through cancer management or anything that you're going through, even surgeries. So, I think the next question I would like to know as well is, how does real TCM work to support cancer treatment? Like maybe you could, both of you, share a case study that you can talk about.
Okay. So I think this is all in my own opinion.
Yeah.
Okay. For the cancer management by the TCM, actually, in my experience, and also my professor experience, so we will doing by the period, like the chemo, like we work with the chemo radiotherapy. Of course, between this period, we are going to reduce the side effect. That is the main objective. Then also we will try to improve the sensitivity of the chemo and the radiotherapy. Of course, like in my case with Dr. Teo, some of the patients, they are during the chemotherapy. Then we can see that maybe the white blood cell, the platelet is dropping. Then we will try to help to maintain. We cannot say that we guarantee we can cure, we can push all the blood reading to the normal, but we can maintain it in a certain level to let the patient to complete the treatment, the chemo. And also, the symptom, right? Like some of the patient will like to vomit, the nausea, right? Then after taking the herbs, they will feel better. What we so far is feel better, but it's still got the feeling. But it's still got feeling. So this is the first period, and the next period actually is the post treatment period. Like after the chemo, after the radiotherapy, then we try to reduce the risk of the recurrences. Yeah, and also maybe in the pediatric care, we try to improve the quality of life. Yeah, to make the patient feel better. Yeah, that is what we do, and we mostly we do it by giving the herbs, and also some of the practitioner will give like acupuncture and cupping. Yeah, but for the acupuncture and cupping is most like the pain management. We doing for the pain management, but here we have to mention, please, don't do massage. please don't do massage. Even any TCM say that, oh, you're this pain, you can do the massage, you do massage. Please don't do massage because we don't know whether got the bone mass or not. If got the bone mass, the bone is fragile. Then if the TCM, they don't know, they just do the massage, then we won't kill. Yeah, so that is what I want to highlight. This is very important. Even you go for any TCM.
Maybe what you mean is the twin type.
Yeah,
not the traditional.
Not like go Thai massage.
Yeah, not that type.
not the time.
But also don't go Thai massage. Right?
Yeah, also it's very dangerous. I have experienced a patient, a patient, the both here or backside.
Okay.
And then he can't feel the below the leg
After the massage.
After I give him the herbs for few months, they started feel a bit feeling on the leg. But some of I think it's his mother or someone introduced him to go to massage. But then the Sifu said, oh, this is because of your the blood and chi cannot reach your feet. Then massage after that gone.
No feeling.
No feeling anymore. And I can do nothing about that. I said, why? I already told you don't do massage. Why you want to go for twin? Yeah.
Not our conventional massage.
Right.
That is
Not the
different type.
relaxing.
No, not the dressing.
because they want it more harsh.
I think what about Dr. Teo? I think both of you work together. Do you have a specific case study? Like you mentioned increasing platelet. I think that is something I've heard multiple times that TCM can actually help. So was there a similar case as well?
Okay, first of all, I need to let you all understand, in my point of view, right, when should TCM come in? Actually, TCM can come in in every moment, but depending on different phases of treatment, their importance are different. Let's say you are at the early stage, okay, then for me, you should concentrate on complete your standard treatment first. Let's say maybe your surgery, your chemo, your radiation, you complete those things first, then only you go for TCM for recovery. Okay, because your treatment usually will not last that long, your treatment phase. Maybe just 2 months, 3 months or 4 months, or maybe for some colorectal case, maybe up to 6 months, 7 months. Then after that, you go for the recovery phase. Then that time you go. In between, if you want to go, let's say during chemo or during after surgery time, right, for a short period, is still okay, but then you need to make sure you go to the certified right person. This is a very tricky word, certified right person. Okay, then because at that moment, right, you need to make sure that your disease is controlled, suppressed, settled. Then you go for this kind of thing. On the other hand, let's say you are already at the advanced stage. Your treatment aim is more on a palliative. Is for quality of life maintenance. Is for life prolongation. This kind of phase, right, TCM, their role is more important. Okay, does not mean that they can supersede the standard treatment. It's just that they need to come in more frequent already. Because the patient, not only to treat the patient's body to let them feel better, you also, your existence, your health can make them feel mentally more relief. Okay, this is how I explain to the patient. And regarding the experience that you mentioned, right, usually for blood counts, let's say after chemo or radiation, usually we will have marrow suppression. Marrow suppression means the white cell, your red cell, your platelet will be suppressed. So in Western medicine, we do have a lot of good measure to actually bring up, to shoot up the thing. We have boosters, we have medication, we can even give transfusion, this kind of thing. But a lot of people, they feel very offended. Or sometimes due to religious purpose, some people don't want to be transfused. Yes. Okay, we do have this kind of group of person, okay, they don't want to be transfused. So usually for this kind of patient, if you ask them to take the hematinics, that means the blood, like vitamin, this kind of thing, iron, the effectiveness is a bit not that good, and then usually take few months only can see the effect. And we are doing treatment, we need to constantly make sure that your counts is at a certain level. That time you can consider to take some, but also from certified person. Okay. Regarding the experience, I do have another patient. Do you realize that, do you know that I got few Indian patients actually go for Chinese TCM acupuncture after their chemo? They always like to do that because they say that the acupuncture make them feel that
Like better sensitivity?
Yes, because some patients because the usage of certain chemo drug, they get numbness of it.
Yeah.
And then they say that after the acupuncture, they feel better. But the problem is not solved. It just maybe lasted for about 1 week, 2 weeks.
Oh, that is good already. Sometimes 3 days only.
Then after that, the numbness sensation will start to come back, but somehow will make them feel better overall because the quality of life better because they can continue their work.
Yeah.
That's very good.
Yeah, so I have to highlight again, TCM cannot replace the Western treatment. Yeah, so we only the complementary medicine. We are alternative, but we still have to complete like chemo, radiotherapy. That is very important. So all of my patients come to me at first time. I always say that you have to go to see doctor. You cannot only rely on herbs. Yeah, what our role is only the complementary treatment. Yeah, that is very important because some of them come to us. They are looking for the
Diffusers, not
diffusers. They say the chemo will kill people. Then I will tell them, why a doctor trained to kill people? Right. So we are going to help people. So we have you as long as you hurt maybe someone is maybe suffer in the chemo, but you didn't know how many is saved by the chemo.
Yeah, I like that statement. It's true. It's very true.
Is it?
There are more people saved by chemotherapy and immunotherapy and all these type of therapies rather than
Yes.
people dying.
Of course, the chemo is suffering. We know that. We know that suffering, but it save a lot of life. We have to admit that. Yeah. So as long as I'm a TCM, I always say that the Western is now the priority. It's the mainstream. It's very good. It save people, save life. Why not we go for it? As long as it is so good, then we play our role. TCM play our own role. Then we help the patient become better, feel better, or not only the physically and also the mentally. They feel better. Then we work together, make the patient become better. That is what we work. Like I work with Dr. Teo. Yeah. So we cannot against the chemo, against the surgery. I hate the people say that you don't want to go for the operation. You don't want to go for the chemo. I hate it. Seriously.
Especially for early stage.
Yeah.
Let's say,
That was it.
for example, let's say patient is already stage 4. He is on the terminal phase. I can accept you choose not to do the standard treatment. But let's say you are at the curative phase.
Yeah.
You're early stage 1 or 2. And then because you cannot accept the concept of chemo or radio or surgery, you choose alternative and make your disease from stage 1 to stage 4, right? This is so wasted.
So yes. So some of the patient they come to me, then I say, you go for the surgery. Maybe you no need to do the chemo.
Yeah,
Because you're early stage, right? Why don't you want to stay with me for 3 months to have a trial to see? Then I have to pay the responsibility. Why not you go for the best way? Yeah. So I think the TCM have to know what we are playing.
what's the role?
What's the role we are playing?
Yeah.
There's
I think talking about this, you mentioned a couple of times that TCM, traditional Chinese medicine, is complementary to Western modern healthcare. So I think you also mentioned our first question that it is recognized by the Ministry of Health, Malaysia, right? So you mentioned that traditional Chinese medicine is a part of the traditional complementary medicine.
Yes.
That is recognized by the Ministry of Health.
Yeah.
I see.
Yeah.
Okay. So I think in terms of approach, and you mentioned your experience with TCM as well, Dr. Teo, how did you start exploring TCM for cancer management?
Okay, I start exploring since very early phase of my cancer training.
Wow.
Okay, because I like to talk to patients. Okay, for all the patients who came to me, for sure they will notice that this doctor like to talk to the patients and the family. I spent a long time talking to them, so I learned a lot from them. Slowly I realized, regardless of Chinese, Indian, Malay, they will always try to do something more. Okay, especially when the outcome of the current treatment cannot meet their expectation. They always want to do better, go beyond it, or they want to listen to something suits their mind. Yeah. So eventually I realized, no matter how you stop them, how you explain to them, right, they won't understand. So why don't you just open the whole entire world, open your eyes and see why this thing is so attractive. So I start to read about it. I start to read about all this TCM thing, and then I start to read about all these porcupine dates, or start to read about the
Sambal glass.
yeah, sambal grass, or the apricot seeds, vitamin B17, this kind of thing. Because I need to know why they are so attractive. And almost in most of the cases, right, you will realize those who so-called cure only solely by this kind of method, right, usually come from these few conditions. Number one, they over-exaggerated the outcome of all these products. That means they still go for surgery, they go for chemo or radiation, they completed the whole treatment, but they just amplify the effectiveness of this thing and make people confused and misunderstood that they actually got only this treatment, this particular product, and didn't do anything else. So actually it's quite misleading. That's number one. The second thing is, sometimes they are not even cancer.
Exactly.
They assume that they have cancer.
Yeah, maybe a lump.
Then,
Oh my god.
yes,
Maybe
they assume.
maybe
I can tell you a real life story from my family. Okay, there's one person in my family. From her young age, she told the whole kampung saying that she got this colon cancer, stage 4. Doctor want to operate. She doesn't want to operate. Okay. Then after that, she choose her own remedies. Okay. I say what remedy? And TCM. I say what TCM? Which Chinese physician? She said no. It's just some herbs that the people introduced to her. People ask her to take. Then she started to take all those herbs. Then after that, surprisingly the thing disappeared, and then she doesn't need to do surgery for many years. Then after that, when I became a doctor, it so happened that I managed to see her pile last time.
Whoa.
Okay, it was a polyp.
Yeah.
Oh my gosh.
It was a polyp, and the doctor actually asked her to remove the polyp. Okay, of course, polyp is not a cancer; it's just a benign tumor in the colon.
Yeah, yeah.
Yeah.
Yep.
Okay.
That is what happened. Real life. So real example.
So the public education is very important.
And that's why we're doing this show. So I think it's very important for all of you to understand that to get the right diagnosis and to get the proper diagnosis from a specialist, I think cancer is actually a disease that should not be taken lightly. And for you to say that you have cancer to everyone,
It must be proven.
yeah, it must be proven. So I think one of my last questions to both of you is, what would your advice be to cancer patients who want to start traditional Chinese medicine?
Okay, for me, okay, the problem for this two field is because there is a group of doctors in Western medicine absolutely objectivistic.
Yes. Okay.
And same thing to the Chinese medicine side. There's a group of doctors that absolutely Western medicine are useless.
Right.
So if your doctor is on this type, right, you don't need to ask them already.
Yeah. Okay.
Because for them is this world is only black or white.
That's true.
And they are the white side, the other side, the counterpart is the black side.
Right.
There's
The
no
devil.
okay, for me, anything is possible. Because I approach a lot of Chinese physicians. I've talked to a lot of my patients, regardless of races. They share me a lot of experiences. And then I do actually go and read a lot on all these whatever products. Sometimes I join the program. I join the program and see what they're actually talking, including some nutritional program. Paid myself. I went in and see why all these programs
It's not cheap.
okay. Yeah. Okay. And I want to know, why are they so attractive? Why people so attracted to it? And I eventually realized that you must get the proper channel to get the correct guidance. Okay, before you do any decision. And if your doctors can accept the complementary medicine, for me, Chinese medicine is complementary medicine.
Yeah.
Okay, if they can accept, then only you go for the whatever. If you are from Muslim, we believe you are Chinese medicine, you can go to the Islamic treatment, you can go to Ayurvedic, all this kind of thing. Yes, it's okay, as long as you go to the certified one.
Right.
And try not to hide it from the doctor. One of the problems for a lot of Western medicine doctors is the patient very scared of the doctor once they know that I go to like your case,
Yeah.
this is scolded you, right? Yeah. So they are very afraid that doctors get angry, so they just hide it from them. Just refer to them. Say, doctor, I want to do this, and then I know this. Okay. These are the things I'm trying, or what these are the drugs, or these are the products I'm taking. Listen to his advice. If he say that he strictly reject you from this, then you need to come up with another way.
Yeah.
Okay. Try not to hide it. Okay.
Yes, yes.
From what I know, from what my surgeon friend told me, they get very offended for after surgeries. Chinese medicine is because they cause bleeding.
Yeah, it does.
Yeah.
An example. No, but your patients are very lucky that you actually try to understand where they come from. I think that's-
because you see, you can't stop them.
yeah, it's
You can't stop. You can't stop those. If you cannot stop them, you better guide them properly.
yeah. That's
At least they are not lost. One of the main problem for Chinese medicine in Malaysia, this one I need to help them to say something, okay? Because they don't have a stronghold to protect them. They don't have a strong council to supervise their members. Okay, first of all, not all people who practice Chinese medicine in our country, they are certified Chinese medicine physician. Okay, some of them they are not. Some others they learn some skill from the sifu or from their parents, and then they put out, I think, their Chinese medicine already. Okay, they didn't go for a proper training. They don't have the certified degree. They don't have all these things. Okay, they are not registered. And another way, they are due to some reason, they start to do some funny thing. Okay, that part we don't mention too much. So that's why they don't have a strong council to monitor, to supervise the discipline, not like the Western medicine.
Yeah.
That's why the credibility is a bit low. Actually, they can do better. And throughout my experience for the last 10-20 years, right, I have a lot of Chinese medicine friends. They gave me a lot of this one knowledge on Chinese medicine. That's why, for me, it is doable. But if I be properly supervised by a certified person. Yep.
Yeah. Thanks a lot for Dr. Teo to talk for us. Like for me, if you are the cancer patient, you want to look for a TCM practitioner. First of all, of course, we have to go for the registered medical camp, and please bring all your reports to us.
Okay.
Like if not only the blood test, actually, we also did the histopathology. Yeah, we want to know what is the cell type. We want to know, and also you let me know what the treatment you are going. Like you are doing the chemo targeted, also maybe the immunotherapies. Right? So because different chemo, they cause different side effects.
Yeah.
Yeah, and also different treatment like the radio, the side effect of the radio and the immunotherapy and the chemo is different. So we have to know what you are going to do. Then only what we can help you. So that is very important for how do you recognize which practitioner is they know or not. Yeah. So if the doctor, if the TCM practitioner will ask you, can you bring the report to me? And then you know the practitioner actually he's the one maybe you are looking for. Yeah. And
a lot of people outside there, they don't know Chinese medicine actually look at blood report and scan. They thought the Chinese medicine is to look at your face, feel your pulse.
That is,
It's not only that.
it's not only that. Yeah, seriously, it's not only that. So that is what we want to do. Yeah, we have to know more. We know about what is the Western going on. Yeah, so that only can make us to become better to help the patient. Yes, so that is maybe what I can tell about to looking for proper TCM practitioner. Yeah.
Right.
Yeah.
Thanks, Dr. Teo and Dr. Tan, for sharing your thoughts on TCM and how it's safe for cancer management. I think for the audience out there, the 3 key takeaways that I would like to reiterate from both doctors is number 1, when you go and see your TCM oncologist, make sure they are certified by KKM and ensure that you bring your blood reports, your histopathology, your scans, everything that you would to a specialist so that they can look through it and also advise you and guide you on proper treatment in terms of traditional Chinese medicine. For them, I think the second key takeaway for me and I think for the rest of you is that the Western medicine should be the primary form of treatment and traditional Chinese medicine is complementary and not the sole form of treatment. And I think the last but not least is that your TCM practitioner should communicate as much as possible to your clinical oncologist, and both of them should work hand in hand on your case together, because like Dr. Teo and Dr. Tan, they work hand in hand on many cases together to treat cancer patients. I hope that has answered many of the questions that you guys have constantly asked me about traditional Chinese medicine and how it can help cancer treatment, and also sharing my own experiences and hearing case studies from both doctors. If you have any questions, please put them in the comment section below. I'll try my best to answer as many as possible or ask the doctors their opinion before answering you if they have the time. So thank you so much for joining us for this session of Talking Life with MeiSze. And once again, thank you to Dr. Teo and Dr. Tan. Thank you so much, guys. Bye. Have a good day.
Bye.